Good evening, everyone. Uh, can you guys hear me? Am I audible?
Yes, you are.
Okay, thank you
Yes,
for
you
the
are.
confirmation. Good evening, everyone. A very warm welcome to all of you joining us today for this international session under the International Free Workshop 2026 series. My name is Sumaya Nuzrul, and it is truly an honor to host this session today on behalf of the Bangladesh Institute of Innovative Health Research as an Assistant Academic Coordinator. I sincerely thank all participants for joining us from different regions and professional backgrounds. Your presence reflects the growing enthusiasm for learning and advancing research. Before we begin, let me briefly introduce the Bangladesh Institute of Innovative Health Research. BIIHR is a non-profit research-based organization dedicated to promoting a strong research culture, particularly among undergraduate students and young professionals. Our mission is to empower learners through research training, academic mentorship, and skill-based programs, helping bridge the gap between theoretical knowledge and real-world impact in the field of health, science, and policy. Now it is my great pleasure to introduce our esteemed facilitator for today's session, Ms. Devi Das. Ms. Devi Das serves as an honorable advisor at the Bangladesh Institute of Innovative Health Research. She is also a project research assistant at the Indian Council of Medical Research Center for Aging and Mental Health in Kolkata, India. She holds a master's degree in physical and biological anthropology from Punjab University, Chandigarh, India. With her academic background and research experience in public health and mental health studies, she brings valuable insight into today's topic. We are truly privileged to have her guide us through this workshop titled From Idea to Systematic Review, a Beginner's Roadmap in Research. Before we begin, I'd like to share a few quick guidelines. The session will run for approximately 1 to 1.5 hours. The language of instruction will be English. Participants are encouraged to ask questions through the chat box or during the designated Q&A segment. We encourage everyone to actively participate so that this session becomes engaging and beneficial for all. So without further delay, I would now like to invite Ms. Devidas to begin today's session and guide us through this important topic. We are truly excited to learn from your expertise. Over to you, Ms. Devidas.
Thank you. Am I audible?
Yes, you are.
Okay, thank you. Thank you for the very kind introduction. So thanks to BIIHR for giving me this opportunity to talk about a very interesting type of research with researchers from different backgrounds and disciplines. So I'll just quickly share my screen. Is it visible? Is the screen visible to all of you?
Yes,
Okay. Okay. Great. Okay, so the topic of today's discussion is the from idea to systematic review. So basically, I will talk about how we conduct a systematic review, the processes of this review. Okay, so let's start with a simple question. Okay, so just imagine you are reading about a treatment, suppose treatment A. So one study says that this treatment will work perfectly. But the another study says the treatment won't work. So, which one would you trust? What would be your recommendation, maybe to your patient? What would be your decision? So, if you ever felt confused by conflicting study results, that's exactly where this entire concept of systematic review begins. Today I will walk you through how we move from that confusion to clarity using systematic reviews. So before before going any deeper, so let's simplify one important term, actually two important terms. So what is a review? Like a normal review we usually do. It is basically when someone or a researcher leads multiple studies and summarizes the results or the findings, often based on their understanding. So we call it as a review. So review is like telling a story and gathering information from different multiple studies on a specific topic. So what is systematic? What is the difference between a review and systematic review? Review, it is like a story gathering results from multiple studies, but a systematic review is systematically arrange the studies and find out the relevant literatures, and then we summarize the findings of the multiple studies. We follow a very rigorous and systematic process. So that's why it is known as the systematic review. Okay. So suppose you have a task of evaluating a treatment for a disease. Suppose treatment 1. So one study shows that treatment is effective and another study shows the treatment does not show any effect. But the third study shows possible harm to the patient. So what would you recommend to your patient? Would you recommend the study 1? Or you won't recommend because there are conflicting results from different studies. What should guide your clinical decision? So, relying on one study can lead to inaccurate and inconsistent conclusions. So, to improve the clinical decision making, we need to synthesize all the evidence systematically from different studies. Okay. So, this concept is like the systematic review is based on the evidence-based decision making. What is evidence-based? The when you recommend a treatment to a patient or for a particular disease, so what made you choose a particular treatment? What's the reason behind you choosing that particular medicine? So it is the evidences. You based on the evidences. That evidence comes from the systematic reviews, not from a single particular study, as the multiple studies has conflicting results. Okay. So how medical decision making evolved with time? So in earlier days, the evidence-based medicines decisions were particularly made based on single studies. Any maybe cross-sectional studies, maybe RCTs or NRCTs, or quasi-experimental studies. But over time, the researchers realized that there is a problem. One study can be small, maybe the sample size is very limited. Maybe the study has a lot of biases and even completely different from the others. Maybe methodologically, the studies are different from each other. So it is very difficult to rely on the studies which have different methodologies. So we can't do that. So over time, the people started thinking that one study is not enough to guide reliable decisions. So that's why modern medicines now focuses on summarizing all the evidence, not just one study. So this summarizing all the evidence is basically the concept of systematic review. Okay, so these concepts at the very beginning of the systematic reviews, I just have mentioned all this so that you can understand the processes and the intention behind all the steps we follow while we do a systematic reviews. So, what like what does a systematic review tell us? So basically, maybe for example, one study is saying that the prevalence of depressive disorders among older adults is 12% in India. And the another study is saying that the prevalence of depressive disorders among older adults in India is 7%. So there are two different numbers. One study says to 12% and another is saying 7%. So what is the actual scenario? So to find out this actual scenario, we usually do systematic review. So what systematic review tells us? Systematic review will tell that the pool prevalence of depressive disorders among older adults is 9%. So to get the 9%, that number, we usually do systematic review followed by the meta-analysis. Meta-analysis is nothing but the statistical analysis of the data. It is known as the meta-analysis because it is the analysis of the data from multiple studies, not one single studies. Okay, so it is just this statistical analysis. So today we will not talk about meta-analysis, but I will try to cover as much as I can about all these steps of systematic reviews. So, okay, so I've just mentioned systematic review is a method that collects all the relevant studies on a single specific topic. Systematic review evaluates and combines their findings. And as I have just give you an example of the prevalence of a disease. So it systematic review tells us how common is the disease, how does it progress, that is the prognosis of a disease, and what tests are accurate, that is the diagnostics, and which treatment work best, intervention. So to find out all the answers, we usually include different type of study, like the different studies with different study designs. So for intervention, we need to include the RCTs and NRCTs. For prevalences, we usually include the cross-sectional studies. So that's how we conduct systematic reviews. Okay, so systematic reviews, as we combine the results from all the available literature on a specific topic, so it helps the results of the systematic review helps us make the clinical guidelines or the public health policies. These basically the implications. So, what is a systematic review? In simple stuff, instead of, I just mentioned, trusting just one study, we look at all the studies together. What do? We first search all the available researches from different databases. I will talk about this later, and pick the relevant studies and check if the studies are of good quality, and combine the results to get a clear picture. For example, instead of just asking, does this treatment work in one study, you will get this answer from any studies like the RCTs or NRCTs, but a systematic review will tell you what do all the studies together say about this treatment, whether the treatment is actually effective or not. So key message, a systematic review gives a more reliable answer by looking at all the evidences, not just one study. Okay. So this is the level of evidence. So okay, so if you look at this pyramid, so you will see systematic review and meta-analysis right at the top. So anyone is saying something? Okay, so you will see the systematic review and meta-analysis at the top of the pyramid. So what does this mean? It means a systematic review provides the highest level of evidence. I talked about the evidence-based medicine. So this is the level of evidence. So that means we can rely on ESAs for ESAs means systematic reviews for decision making or to select which treatment to provide to the patients. Okay. So if you look at the pyramid, except the ESAR, all the other level of evidences include the single study, like RCT is a single study, NRCT is a single study, case control and cohort is a single study. Okay. So there are some kind of like level 1 evidence, that is the systematic review. There are multiple level of evidences. Okay. So there are other type of evidence synthesis. So the first type is the narrative review. What is a narrative review? Narrative review usually address several aspects of a disease, such as the cause, diagnosis, treatment, prognosis. Uh, Basically, a narrative review presents a scholar like summary of these aspects and may include an interpretation or critique of the studies involved. So, like similar to a typical book chapter, they provide a broad overview of a topic. It involves higher risk of bias because it does not follow a typical systematic way, and limited use for estimating the results, the outcomes, effect size, and it synthesize all the data. Other one is the scoping review. So the scoping review is it is very similar to the systematic review, but okay, so systematic review basically maps the existing evidences and key concept in a research area. It also find out the number of studies. Suppose how many studies have been published on a topic, or the number of studies published over the years, the type of study designs conducted, the type of settings explored, which tools researcher used to measure a specific maybe disease or a mental health disorder, or which specific health outcomes have already been assessed. So the systematic review should not focus on the results of the studies, but it should synthesize the evidences. So systematic review also follows a systematic process, just like systematic review, and it is reproducible method. Like as it follow a systematic process, we can follow that process to reproduce the result. Okay. So it basically helps us guide future research, not answer a specific effect questions. Outcome is not the main thing in systematic review. We need to elaborate the research. Like I like to know the number of studies, which what are the research gaps. To understand all this, we do systematic scoping reviews. So what is an umbrella review? Umbrella review is a systematic review of systematic reviews. So in umbrella review is synthesizes the evidence from existing systematic reviews, not individual studies. In umbrella review, we only include systematic reviews. So it answers the broad questions, effects of multiple intervention across populations, or summarizes finding from included studies. Okay, so so umbrella review basically do not perform or any separate data analysis, because the it usually present the outcome data from the new studies not included in any SR. So generally, see, umbrella review basically conduct this. Yeah. So the additional data analysis which has not been done yet. Okay, so I'll not talk about the other reviews anymore. Let's move on to the main today's topic, that is systematic review. So, what are the key components of a systematic review? So, it addresses a clearly defined or specific research questions. These research question is something that will guide the entire process of the systematic review. I will talk about this later, but also to ensure the transparency and avoid duplication, uh, the systematic review follows a registered protocol. So you should register your protocol. That is, it's just like a research proposal type of a thing. So you should register your systematic review proposal on Prospero. It's a registration database. You will get a number like CRD number when you will register your systematic review. Okay. So another important thing is to develop a comprehensive and reproducible search strategy for multiple databases. So I will talk about all the components explicitly, but I'm just giving you all an overview. Okay, so systematic review always follow an explicit inclusion and exclusion criteria just to ensure that only appropriate studies are selected in the review. Okay, it follows a very systematic and structured selection process. There are multiple selection processes like title abstract screening and full text screening. I will talk about this. Also, it includes a standardized data extraction. We use a systematic way of doing the data extraction. Also, we do the quality check of each and every included article in a systematic review by using my standardized tools like Access Tool, Robin 1 and Robin 2. There are multiple other tools. I am just giving you some examples. Like for cross-sectional studies, we use Access Tool. For NRCT, we use Robin's 1 and RCT's Robin 2. So Rob 2. So there are multiple tools. Okay, so the findings are synthesized after the data extraction process. So either you do the narrative synthesis when you do not have homogeneous data to do the meta-analysis, you just do this narrative synthesis. When appropriate, you always go for a meta-analysis to quantitatively combine the results of your study. This systematic review minimizes the bias, ensure transparency, and of course the reproducibility as we follow a very structured way. Okay, so typically conducting a systematic review, a very rigorous process that may take around 10 to 12 months, even more than a year sometimes. And also, to complete a systematic review, you at least need 3 independent reviewers, not less than that. You can have more, but not less than 3 reviewers. It is a rule. So there are multiple types of systematic review. I won't say these are the types. So I've just mentioned the study design that you can include in systematic review. Of course, you can include all the study design, that is the intervention, like the randomized controlled trial. In our city, you can include the cohort study, cross-sectional study, anything you can. All the observational studies you can include, and you can also test the diagnostic accuracy of a specific test. Okay. Also the prevalence, I gave you an example of that. So say steps of systematic review. Okay, so first is generate a research idea. It is also necessary when we conduct a like cross-sectional study or RCT to have to have an idea of your research question. It's also similar for the systematic review. So then you need to formulate a research question. I will talk about all the steps, but this is the just defining the objectives, developing a protocol, uh, eligibility criteria, that is the inclusion and exclusion criteria, literature search strategy, then study selection criteria, data extraction, quality assessment, meta-analysis, interpretation of results, and reporting. So these are the key steps of a systematic review. I will try to give an overview of all the steps. So to conduct a systematic review, you need to understand all the steps. So for this, like we need actually 1 hour session for each step ideally, but I will try to make you familiarize with the important concept and steps so that you can explore it later on if you are really interested in this. Okay, so identifying a research idea, how will we identify one? Okay, so choosing the right research topic or the research question is the first and foremost step in any research process. So a good research topic for a systematic review should first be relevant. It means it should address an important clinical issue or a significant public health problem that can make a meaningful impact. You should not take up any topic that won't, you know, that won't make any difference in the world. Now, the next thing is the feasibility. So your topic should be feasible. It is important to ensure that there are enough existing studies and you have sufficient time. As I mentioned, that it may take up to an year and more than that sometimes. And the resources, you need resources to get access of different databases. So, and your topic should be novel. Like a strong research topic should fill a gap in the existing literature. So it should not be something that has already been reviewed or done, but you should find out some area where evidence is limited and inconsistent, or there are some methodological flaws in other studies. Okay, so a topic should have a potential to influence the clinical practice or policy or future research. It should have a intention. So what are the sources of research idea? So one major source is the clinical problems. So this question may arise from the real patient care where clear answers are unavailable or lacking. So the another thing is literature gaps. For that, you need to study a lot of literature, relevant literature. So where the current evidence is insufficient or conflicting. And the another source is like your supervisors or experts who guide topics based on ongoing priorities or experience in a specific field. Lastly, emerging some topics like the new technologies, new interventions, or new disease provide like exciting opportunities for impactful research. Because imagine you will spend your 10 months and only to find someone already published the same review last year. So you don't want to do that. Okay, so formulating a research question, why it is important. As I mentioned, the research question will guide the entire systematic review process. the inclusion criteria, what analysis you need to do, everything will depend on your research question. It will determine your search strategy, as I mentioned, outcomes, everything. So, what is the characteristics of a good research question? It should be clear, focused, specific, answerable. It should not be vague, relevant to clinical or public health practices. For example, what is a research question, like example of research question, not so good research question? So what is the prevalence of mental health disorder? It is very wide. You won't be able to find out a specific answer to this question. Your research question should not be broad. It has to be very, very specific. So what is a specific research question? What is the prevalence of depressive disorders among older adults in lower and middle income countries? This is a specific question. You just can see the components. I have mentioned the depressive disorders, it can be the outcome, older adults, this is the population, and I have mentioned the study area, that is the lower and middle income country. So it is very specific, and the previous one was very general. So the outcome was not very specific, too wide. There were no study area or no population. So the previous one is very, very wide. Okay, we usually use a structured framework to make our research question. What are those? Just imagine the previous example I have mentioned, that the specific research question, that was the what is the prevalence of depressive disorders among older adults in LMICs. So how will we create a research question? So there are frameworks. That framework is known as PICOS. So P stands for population, defines the group of interest, the age or the population, or the disease condition. Maybe the malaria patient is your population. And the intervention, the treatment, procedure, or exposure you want to study. C stands for comparison, like comparators. Like suppose you have an RCT, you are comparing two treatment. The treatment one is a medicine one, and treatment two is placebo. Placebo is your comparator. You are comparing the results. Which one is giving more? Which one is more effective? And the outcome, the measurable effect. Outcome is the prevalence of depressive disorder is your outcome, or if you have a comparator, which treatment is more effective, that is the outcome, which treatment. And the settings, LMIC was my settings, so lower and middle income countries study area. So this is how we frame our research question in a very structured way. Okay. So why do we use frameworks? To improve the clarity and precision of the research, guide search strategy and keyword selection. I will talk about this later. And ensure relevant and consistent study selection. It reduces the ambiguity and the enhance reproducibility. Let's have an example. I will again cite the same example. So as I mentioned, depressive disorder is one component. What is it? It is the outcome. And the older adults, it is the population. And lower middle income country, it is the setting. So depressive disorder is outcome, population, and setting. Okay. So next one is preliminary search. Okay, so by now you have your research question, right? So you have made your research question. You are clear about what you need to do, what you want to do, and what to do to obtain the results. You have a clear information or idea by now. So the next step is to assess the feasibility of your topic. So you need to do a preliminary search. So what is it? So usually you have to look for the available relevant evidences which is very similar to your topic, from different databases like PubMed, Scopus, Google Scholars. There are multiple. So you have to identify whether enough primary studies available or not. Like you have to remember that you cannot conduct a systematic review on a topic where no primary studies exist, as there would be no data to synthesize. So you have to have enough primary studies. Whether a recent systematic review already exists or not, using filters like systematic review to check the duplication. I will talk about this. Okay. So look for published studies that are published after the last systematic review on that topic, methodological gaps in existing reviews. So these steps ensure that your research is novel, relevant, and not you are not repeating the previous research again. Literature search strategy. I'm citing the same example to make it relevant. So as I already mentioned, that population is old age or older adults, depressive disorder is the outcome, and the lower and middle income countries is the cities. Okay. So if we are considering this question as our research question, so this is the population. This we call it the search strategy. This is the outcome, the safety. So this is an example of what a search strategy looks like. So we need actually another 2 hours to actually understand the process, like how to develop a search strategy, how to search across different databases, because all the databases have their own way of searching. So there are multiple strategies. So we need actually a lot of time doing that. So if I have time at the end, I will demonstrate this using PubMed if we have time. So for now, just familiarize yourself with how a search strategy looks. Okay. Okay. So as I mentioned earlier, that you need to develop a protocol. That is the blueprint of your research. You have to mention everything, like how you are going to do a research. Okay. Must be prepared before the registration on Prospero. You should include the rationale of the study. It is uh, it is exactly like how we write the introduction. It is the introduction only, like how we write the introduction for cross sectional studies or RCT. It you will write the introduction in the same way. You need to mention your research question. You need to mention your eligibility criteria, what kind of studies you want to include or exclude. And this is the search strategy. You need to also mention search strategy in your protocol. And also you need to mention the databases you will search. Additionally, what are the outcomes you are interested in, and the statistical methods you plan to use, especially if you are doing a systematic, meta-analysis. So finally, you need to mention the implications of the study, like how the findings might contribute to the practice, policy, or future research. So you can use this link to look for the Prospero registration. You can explore on your own how to. There are multiple questions, like 40 kind of, like, yes, 40 questions you need to answer. They will ask you what your question, what are your inclusion exclusion criteria, how will you do the statistical analysis, how will you assess the quality of your research. I have just mentioned Axis, Robbins one. You need to mention the name of the tool you want to use to assess the quality. So you have to answer the all methodological questions when you want to register the protocol on Prospero. So this is the eligibility criteria. Okay, so these are the RQ. What can be the inclusion criteria? I want to include only observational studies reporting the prevalence of depressing disorders among older adults. What are the exclusion criteria? Suppose I don't want to include the commentaries, conference proceedings, and editorials. You need to have a proper reason for that, actually, why you want to exclude some of the studies. So you can include the studies published only in English, or you can include studies in any language. That's up to you. If you have the resource to translate the studies into English, that's up to you if you want to include. Also, if you don't want to include the other languages, you have to mention it in the limitation that we could not include the studies that were not in English language. So this is your limitation, because you may lose some of the important information if you don't include the non-English studies. So that is your limitation. So the study, as I mentioned, the lower middle income country. So I will utilize the list of World Bank 2023 LMIC list. So you need to have a proper reference for that, because in the later stage, reviewer can ask you why you include uh, a specific country, maybe any country that can be. So you have to have a reference, like to show the reviewer that I have referred to this World Bank 2023 list. If you're if you're including studies all over the world, so you don't need to mention something like this. You can also do that. It is not necessary to have a proper settings. You can explore the worldwide studies. You can apply the time restriction. If you don't want to, you don't need to apply any time restrictions. That's up to you. Maybe you want to include the studies published from 2020 2010 to 2020, but I want to include all the studies. That up to your research question, but you have to have a proper reason behind that, because reviewer can ask you why you did not take the why you applied this time restriction. Is there any reason? So this is an example of protocol. This was our study published in a journal. So you can refer to this protocol. It's a very, we have followed all the process of writing a protocol. So you can refer to this. You will have a better idea, I guess. Okay. So multiple databases. There are multiple databases actually. PubMed, Scopus, Web of Science, embase, Cochrane, Google Scholar, Epistemonics, multiple. So, to ensure that your review is very comprehensive and complete, it is essential to search across multiple databases. Reason behind that is each database indexes different journals and studies. So no single database contain all the published literatures. So relying on just one source may result in missing important studies. So which can introduce bias into your research review for that matter. So by searching multiple databases, you improve the coverage of your finding and ensuring that your review captures all the relevant articles. You are not leaving behind any relevant literature. You can also add gray literatures like reports, government documents, etc. Okay. So next is, now we have another web-based application that we use in systematic review, that is Brian. Again, I don't think I would be able to show you how that works, but I will give a brief introduction. So, okay. So Ryan helps us removing the duplicate studies, title and abstract screening, full text screening, also allows easy inclusion and exclusion criteria. improve speed, transparency, and collaboration, blinded review. Sorry. Okay. Uh, so, uh, so blinded review is something that when two researchers are screening studies, they cannot see each other's decision initially, so which helps reduce the bias. I will encourage all of you to register yourself with your mail ID in Ryan and explore it because it is a very easy to use application. I am trying to give you an overview of the steps so that you can explore. It is a very easy to use, so you can use it. Also, you can invite your collaborators or other colleagues by using their mail ID, but they have to have a RAN account. So you can use for you can add other people so who are in your team. So it helps you to you know. Okay. Okay, so what do you do with Ryan? So first, the all the studies we extracted from uh, retrieved from different databases. We upload the file into Ryan, all the files. So these are the steps we follow in Ryan. I will try to cover all the steps. Step one is duplication remove, title abstract screening, conflict resolve, field text screening, again conflict resolve, data extraction. So what is duplication remove? That is the step one. So just after exporting all the articles to Ryan, the first step we follow is duplication remove. So when we search for articles in multiple databases, like you are searching in PubMed, Scopus, Web of Science, the same study often appears more than one. For example, one paper you might like that might be indexed in three different databases. So when we download the results, we may get three copies of the same result, same study. So these repeated entries are called duplicates. Okay. So if we don't remove them, we might screen the same study multiple times. That will create inconsistency. So we might it can like you will end up wasting your time like reading the same article multiple times, and it will reduce the accuracy of the review. So basically, Ryan helps you identify the duplicates and remove them. You can like multiple reviewers can remove the duplication at the same time. So basically, two similar articles will be shown on the screen, and you have to read one of them if they are similar. If you think they're different, you can keep both of them. That's up to you. You just need to read the article. This is the step. Duplication. So just after removing the duplication, the step two is title abstract screening. Okay. So in this stage, we go through each study based on its title and abstracts to check whether the study is relevant to our research question. So we will use our inclusion and exclusion criteria to make the decision. This particular process or step should be done by two reviewers independently in a blinded mode. I just uh, have mentioned that what is a blinded mode. One researcher won't be able to see the response of another researcher that is blinded. Each individual independently mark studies if they want to include it, exclude it, or they are unsure. So there is an option called maybe. So this step helps us quickly remove the irrelevant studies. It saves a lot of time. You don't need to study the full text. You just need to study the title and the abstract. Okay, so in most cases, you can easily identify the completely irrelevant studies just by looking at these two components. But if you have any doubt, do not hesitate to include any study. If you have any confusion like should I include that study or should I exclude, without even giving a second thought, you just include the study, because later during there are other steps of screening when you will have more opportunities to exclude a specific study if needed. But if you exclude it too early, you may miss an important study permanently. So it is always recommended or advisable to be inclusive at this stage and only exclude studies that are clearly irrelevant. So when you exclude any study, give a reason for exclusion. The reason can be wrong population, wrong study objective, or wrong study design based on your research question and inclusion exclusion criteria. You will need this reason later on. Just as of now, you just remember you have to give a reason for exclusion. The next step is conflict resolve. What is conflict resolve? Conflict resolve is when it is common to have disagreements about whether a study should be included or not, because two different individuals was doing the title and abstract screening. At this stage, you need to turn off the blind. So both of the researcher will be able to see each other's decision. The in this stage, the two researchers should discuss these conflicts to reach a mutual agreement. If still they are not able to agree, a third reviewer is involved to make a final decision. That's why I mentioned earlier that you need at least 3 reviewers to do a systematic review. This was the reason. So this is the main. It ensures the fair and unbiased selection. The next step is full text screening. Okay. So the remaining studies are reviewed in the full text. We in this stage, we need to retrieve the full text of the study. Uh, Usually, we search the study title on Google or other databases and download the PDF of the article and upload it to Ryan for each corresponding study. In this stage, study number, the number of included study can be 100, 200, or even more. But you need to download all the full text of the study and upload it to Ryan. If this step is very time consuming, in this stage, again you need to turn on the blind, and again two reviewers will review all the studies and no one will be able to see each other's decision. Okay. So in this step, this is the final step of screening. So you need to study, you need to read all the full text very like very specifically. You uh, need to understand what were your inclusion exclusion criteria, what were the study design you wanted to include. You need to very specific in this case. You cannot include all the studies like in the previous days. That was the uh, title abstract screening. you have to be very inclusive, but in this stage you have to be very specific, because this is the final stage of screening and you need to find out the articles that will eventually give your your answers to your RQ. So you need to be very specific in this phase. Okay, so you need to study all the results, outcomes, if you have relevant, if you have any answers relevant to your RQ. So you have to read it very minute. So there may be some studies in this phase that for which the full text is not available, or maybe you couldn't find the full text of a study. So there should be, those studies should be clearly marked and given a reason, such as like a full text not available or no full text, something like that. You need to highlight those studies, how many full texts you could not retrieve. So that number is important. So for every study that is excluded at this stage, like the previous one, it is important to give the reason for exclusion. Okay, because you need the information later, in the later stage, when we'll do the prisma flow diagram. I will talk about this. And again, because the blind was off, there should be another conflict resolve stage. Again, the same process will be followed. The blind will be off. The two researcher will try to agree. If not, the third researcher will intervene and make a decision. The same stage. And next, the data extraction stage. We usually don't do it in Ryan, but we usually use Excel data sheet or Google data sheet for the data extraction. So this stage is like we systematically collect all the important information from each of the included study. And data extraction should only be done from the studies that has uh, relevant information, like which will answer, which will have answer to your RQ. Otherwise, we don't do data extraction. So we usually use a standardized data extraction form, so that same type of data information is collected from all the study. We Okay, so usually include the information like name of the study, year of study, sample size, study area, study design, male female percentage, outcome, limitation, everything. If you find any information that will be of your interest, you just simply extract the data. Uh, Sometimes data extraction will depend on your research question. What are the results you want to extract from each of the study? Based on that, uh, we usually make a data extraction form. Like we write the name of the information that we want to collect in multiple columns, and we start the data extraction. We usually do this step with at least two reviewers, so that the assessment is more accurate and less biased. The next step is quality assessment. Quality assessment is, after we complete with the data extraction, the next step is to check the quality of the included studies. Using standardized tool, I just mentioned that Access, Robin. So these are the tools for quality assessment. So at this stage, we evaluate the methodological quality of each study, just to understand how much we can trust its findings. So we also identify any biases or limitations present in the study. Again, we two of the reviewers do this step. Common tools. Okay. So why do we do quality assessment? Because poor study quality can mislead our conclusions. Uh, we need to make sure that only reliable evidence contributes to our review. So we need to somehow understand which study is more reliable. We don't need to exclude the study, but we need to assess the quality because we'll have to write about that when we'll write our manuscript or report. What are the key points then? So each quality assessment tools usually contain around 20 to 25 questions. Question are like uh, was the sample size calculated? Was the aim of the study defined? Was the blinded blinding was one blinding was there in case of RCTs or so these are the kind of questions. There okay. So So the key points, all excluded studies must have a clear documented reason for exclusion and during title, abstract and full text screening. So I just mentioned that you need to give a reason for exclusion. So keeping track of number of studies at each stage, number of included and excluded studies, use Prisma flowchart visually represent identification, screening, eligibility, inclusion. Clearly shows the study selection process step by step. This is called the Prisma flowchart. So as you can see, records identified from like the total number of records is 637. You need to give the specific number of articles that were retrieved from different databases. Like we retrieved 132 articles from PubMed, 110 from Scopus, Cochrane 24 from Scopus, 146 from MBES. Like this, you need to write. Also, you need to write the total number of articles. That was 637. And then, what was the step 2? The duplication removal of the step 2. So, immediately write duplicate records removed. Number is 401. So we removed 401 articles in the duplication removing stage. So what are the number of articles? 637 minus 401. That will go to the step 3. So 236 article will go for title and abstract screening. So we did the title abstract screening of 236 articles. Then we excluded excluded the irrelevant studies by just looking at the title and abstract. 180 study we excluded. So I mentioned the reason. For wrong outcome we excluded 147, for wrong study design 16, for wrong population 15, wrong publication type 2. So that's add up to 180. So in the screening stage, we deleted 180 article. So the number of study sought for retrieval. Retrieval means a full text screening. So we did the 56 articles went to the full text screening phase. So reports not retrieved is 4. That means we could not find the full text of 4 articles. So 56 minus 4 is 52. We did the full text screening of 52 articles, and then we did the 50. We read the 52 articles thoroughly, the full text of all the 52 articles. Then we excluded again 37 articles by reading all the full manuscript. So no separate data is 4, wrong outcome 30, wrong publication type 1, wrong study design 2. So we excluded 37 studies in the full text screening stage. So 52 minus 32 is 18. So finally we included 18 study. So that's how you need to explain all the numbers through your Prisma flowchart. So it is important to keep a track of all the numbers. So how many studies you excluding, how many studies you are including, like that. Okay. The next important step is manuscript writing. Manuscript writing is like the other studies as well. So manuscript writing consists of introduction, material methods, results, discussion, limitation, future recommendation. So material methods is something that will be different from the cross-sectional or RCTs. So literature search will be there, study selection criteria, data extraction, quality assessment, statistical analysis. Sorry. So introduction, you need to explain the background and context of the topic. Why you want to do the study, what is the important, and you have to clearly state your aim and objective of your systematic review. And by mentioning that no previous systematic review was done or something like that, this particular systematic review will give this kind of new information. So that's why we are doing this review. So you need to write like this. Oh, okay. So the material method section, you need to write this literature search strategy. I showed it to you earlier. You need to mention it. And the study selection criteria, what will be your exclusion and exclusion criteria? How will you extract the data? What tools will you be using to assess the like what tool you use for quality assessment of the study, and what statistical tools for the meta-analysis it is, what statistical tools for what test you applied for the meta-analysis. You need to write like that. Material method section. Result section, you need to present the findings of the review. You need to attach the Prisma flowchart in the result section. And you can write 1 or 2 lines about the Prisma flowchart that we retrieved this many articles and we finally included 16 or 17, whatever it is, these article in the final review. You have to write that. And in the result section, we usually make not necessarily two, but definitely a separate table to write the characteristics of the study. That is the sample size, country, whether it was done in urban or rural population, community or hospital based, male female percentage. These are the generic information. And the next table, the main findings are there. Like you can add table, or if you have done the meta analysis, you have to attach the figures in the result section. If meta-analysis is done, then pooled estimate and forest plots. Next segment is discussion and limitation. You need to interpret the main findings. It's just like the discussion we usually write. Nothing different. And the limitation is like identifies weakness of the review. You need to be very, very specific in the limitation section. Like you need to you need to talk about the risk of bias in the limitation section, or if you did not have any access to a specific database, you need to talk about that, because everything will eventually affect your study results. So you need to write everything in the limitation section, that you could not add the non-English literature, that can be your limitation. The studies you have included studies with lower sample size, that can be the limitation. Studies with uh, high risk of bias, you need to include write all the things. Publication bias is something related to meta-analysis, so I won't explain it. And okay, this is the most important thing for a systematic review. As I mentioned, that systematic review should guide the future research, practice, or policy development. So you have to have a very strong future recommendation or conclusion. so you can write like what should be done next based on your findings, uh, or something like we you can highlight any gap in existing evidence that high quality well designed studies should be conducted more to understand the topic in a very explicit way. Or you also may suggest improvements in research methodology so studies can be produce more reliable answers. Also, you can write how your results will connect to the real world problem. So systematic review is basically done to answer a specific question. So to have an implication is very important. You just cannot take up a topic which do not have any relevance in the real world, because publication will be difficult if you choose any topic which is not that relevant anymore. So you need to be very, very careful. Okay. Also, like we use consort or different type of uh, reporting guidelines. For systematic review, you use Prisma guideline. So that is like other guidelines only, like consort. So we usually use Prisma guideline for to report systematic review actually. Okay. References is very important in systematic review. Systematic review involves actually hundreds of references, if not less. So imagine, will you be able to handle 150 or 200 references manually? So it is not possible to handle it manually. So before you start doing an SR, I would recommend you to learn referencing or any reference manager like Mendeley or Zotero, anything. It will help you organize your manage studies, because when you write the manuscript, you need to cite all the studies that you included. Apart from introduction to you, we usually cite studies in introduction, discussions, whatever it is. But in result section also, you need, if you have included 50 articles in the final review, so you have to cite 50 articles in the result section. And when you will write the study characteristics, like this much study was done in rural population, this much was done in urban, so you have to cite all the studies that was actually that were conducted in rural area. So you need to very, very, you have to be very good in handling references, otherwise it will be a very difficult. You can actually in Mendeley, I use Mendeley, so in for that you can make different folders for introduction, how many references you are including. You can keep all the references in introduction folder, and then methods in another folder. You can include all the studies that you will use in reference method section. For the same results or discussion section, you can have other folders. You can add tags or notes. It is important. Okay. So what are the highlights? Approximately 10 to 12 months, minimum 3 reviewers, develop a clear research question, register protocol in Prospero, comprehensive literature search, import RANs in, articles into Ryan, duplication removed, then title abstract screening, then conflict resolved, then full text, then again conflict resolved, then data extraction, quality assessment, if applicable, do the meta-analysis, and lastly, manuscript writing, which is very important. Otherwise, uh, no point of doing an SR if you are unable to write a very good manuscript. Okay. So I have now just come to the end of my presentation. It is actually a lot of information to take in within such a short time, but Actually, unless you actually start working on a systematic review, it is very difficult to fully understand the process. You just make mistakes, learn from your mistakes, and that's completely normal. My intention for today was to familiarize you with the key concept and terminology so that you can explore this area if you have in genuine interest. So there are multiple, you know, videos available on YouTube, or there are multiple sources, so you can check if you are genuinely interested. So yes, uh, like that's it from my side. So if you have any question, query, I'm happy to answer. Should I stop sharing my screen? So sure. Am I audible?
Yes, you are.
Okay. So if anyone have any question,
Can you hear me?
yep.
Thank you for your nice presentation.
Thank
Could
you.
you please give me a little idea about when we conduct a meta-analysis in case of heterogeneous group?
Um, Actually, if we talk about the heterogeneous group, we usually our intention is to reduce the heterogeneity. So that's we do it by doing multiple subgroups, like based on male, female. We do separate analysis to make it more homogeneous. We do it based on the rural or urban settings. We do it community based and hospital based studies differently to reduce the heterogeneity. So the main intention is to make a like increase the homogeneity of the data. So by doing multiple subgroups, we do it, and there are other methods like we do other kind of analysis to do the to analyze the uh, study effect, like if one study is affecting the overall results or not. For that, we do separate analysis. But just to answer your question, we usually do subgroups. That's how we try to reduce the heterogeneity.
Thank you. You know, there are a lot of clinical diversity and methodological diversity and also
Mhm.
statistical diversity
Right.
in the case of systematic review.
Mm-hmm.
Okay, I have the next question. When we conduct a systematic review and meta-analysis, we use the pooled estimate effect or and random effect. Could you
Mm-hmm.
tell us the basic distinction between the random effect and fixed effect? When or where we use the random effect or where we use the estimate effect?
Okay. So basically, that's completely depend on your study design. Actually, just a minute. Yeah. So actually, what to choose, like random effect or fixed effect model? Uh, that's based on your research question or what kind of data you have. But if you have like very diverse kind of data, like no relation, like the variability between studies are very high, so usually refer to random effect. We usually do random effect model. And if there like the studies are more similar, to one another, we do fixed. But we usually go for random effect model.
Thank you for your answer.
Any more questions?
Hello.
Hello? Yes.
Can you please check the message box?
I'm sorry, you are not audible.
Miss Devidas, there's some question in chat box. You can look into it.
Okay. Okay, so someone is asking, challenging to identify a suitable research topic. Well, there is actually no other way to uh, find out the suitable research topic. You just need to critically analyze the paper. Don't you just don't need to write the paper superficially. You just need to analyze the methodology or the findings. What I usually do is in the discussion section or the conclusion section, the authors usually write the future research or future recommendations. If you can have an idea from that as well. So I don't think just apart from reading papers, you can have a lot of suitable research idea. Uh, I have just mentioned that you can have idea from the relevant research discussion section where people talk about the future recommendation. And for systematic review, you can search on Google. And also, there is another effective method. You open a research like research paper, and you go to the reference section and you go through the references. Like you click on the reference, you read the paper, so you will be able to find out most of the relevant papers within a short period of time. So it is an effective one. Okay, so someone is asking whether systematic review is only applicable to health field of study. No, not necessarily, but I am from health field, so I'm not much about the other industries that follow systematic review. So I do not have much knowledge, but definitely there are other disciplines like social science researchers or geography researchers. They usually use systematic review, but I do not have much knowledge about the development studies and its, research topics. Okay, so I will share this slide with you all. That's not an issue. Okay, so I am unable to understand this question. How do these tools assist in generating citation and bibliographies in different style? Please, can you explain this question because I'm unable to understand. What does this mean? And there's another question, is this systematic or scoping? I am unable to understand. You can just turn on your mic and ask because I'm unable to understand.
So I think we are at the very end of our session. If any of you have any questions or queries, please contact BIIHR. And thank you very much, Ms. Devi Das, for such an insightful and informative session. Your guidance on navigating the journey from a research idea to conducting a systematic review has been extremely valuable for all of us. I'd like to extend my sincere thanks to all our participants for joining today's session and for your active engagement throughout the workshop. On behalf of BIIHR, we truly appreciate your time and participation. We hope today's discussion has inspired you to take these next steps in your research journey. We look forward to welcoming you again in our upcoming workshops and academic sessions. Thank you everyone for being part of today's session. Have a great evening. Thank you.
Thank you, but can I have a 1 minute because there are two more
Yes,
questions?
yes, sure.
Okay, so Ryan, free account is enough if you have the that subscription account. So you will require less amount of time because the duplication process can be done automatically in the subscription if you have the subscription. So everything can be done in free account, but you will have more time. Okay, so the last question was, what is the relationship between systematic review and meta-analysis? Systematic review is the synthesizing all the relevant evidences, and meta-analysis is nothing but the statistical analysis, that just like we do in normal cross-section or RCTs. We analyze the data. So when we analyze the data in systematic review, this is known as meta-analysis, and systematic review is the collection of all the gather all the relevant literatures from different databases and do the entire screening, like up to the inclusion of included studies, that comes under the systematic review, and when it comes to the statistical analysis, it falls under the meta-analysis section. Yes, okay, I think I'm done with the questions. Yes, I think we can leave the meeting, right?